Here is the literal English translation of the provided text, the continuation, rendered sat nia, closely faithful to the original meaning, with no changes whatsoever to the content, structure, wording, intent, paragraphs, tone, or any details. I want to start with a number. Every year, millions of people in the world suffer a stroke, and among them, more than 70% are people over 65 years old. That means if you are at this age, or you have parents or grandparents at this age, this is not someone else's story, or story somewhere far away. This is the story of your own family. And there is one more number that I want you to remember. 1 in 4 people has the risk of suffering a stroke at least once in their lifetime. 1/4. If you are sitting in a room with 4 people, then according to statistics, one of them will face a stroke. I'm not saying these things to make you panic. I say them because I know that fear without understanding does not help at all. But correct understanding, knowing the signs, knowing what to do, knowing when to act, can save a life. It could be the life of your loved one. It could be your own life. The scariest thing about stroke is not that it is dangerous, but that it is often missed. Many people think stroke is the scene of someone suddenly collapsing, unconscious, unable to move. Sometimes it is like that. But in many other cases, especially in older people, stroke comes very gently. A little numbness in the hand, slight drooping of the mouth, speaking a little more difficult than usual, a passing dizziness, and the patient or those around them think, oh, probably just tired, probably just old age. Then they let it pass. Then a few hours later, or right that day, everything becomes irreparable. Therefore, today I want to sit down with you and speak very clearly, very slowly, about the 10 warning signs of stroke that older people need to know, and more importantly, need to recognize as soon as they appear. First, let me briefly explain what a stroke is, because understanding the nature will help you understand why the signs appear that way. Your brain is the organ that consumes the most energy in the body. Although it only accounts for about 2% of body weight, it uses up to 20% of the oxygen and glucose. The brain needs continuous blood supply, without interruption even for a few seconds. A stroke occurs when the blood supply to the brain is cut off, either because a blood vessel is blocked or because a blood vessel ruptures. When a blood vessel is blocked, accounting for about 85% of stroke cases, blood cannot reach the brain. That brain region begins to die gradually. When a blood vessel ruptures, less common but much more dangerous, blood floods into the brain tissue, causing pressure and severe damage. Both cases are disasters if not handled promptly. Older people are particularly prone to stroke because of many combined reasons. Blood vessels, after many decades of operation, begin to harden, lose elasticity, and are more easily blocked or ruptured. High blood pressure, very common in people over 60, is the #1 enemy of brain blood vessels. And the elderly brain is more sensitive to oxygen deficiency. Damage occurs faster and more severely than in young people. There is a rule that emergency doctors around the world teach people to remember, called BE FAST. I will explain each sign in detail in the following section, but first, please remember this name. B is balance, loss of balance. E is eyes, eye problems. F is face, drooping on one side of the face. A is arms, weakness in arms or legs. S is speech, difficulty speaking. And T is time. Time meaning call emergency immediately. You do not need to remember all 10 signs at once. Just remember, be fast. You already have in your hand a tool that can save a life. Now let's go deeper into each sign, because I want you to understand it really clearly, not just superficially. The first sign, and the easiest to recognize, is drooping on one side of the face. When one part of the brain is damaged, the nerves controlling the facial muscles are affected, causing one side of the face to become paralyzed or weak. The manifestation is the mouth drooping to one side, the nasolabial fold on one side disappearing, one eye not closing completely, and when the person smiles, The smile looks clearly asymmetrical. The simplest self-check. Stand in front of a mirror and smile widely. Do both sides of the mouth lift evenly? If one side pulls up and the other side just droops down, this is an emergency sign. Or, if you are next to a loved one and see something strange in their facial expression, looking asymmetrical, do not hesitate. Check immediately. The second sign is weakness or numbness on one side of the arm and leg. The brain controls the left arm and leg, and vice versa. When one side of the brain is damaged, the opposite arm and leg side will be affected. The patient suddenly cannot lift the arm or can lift it, but the arm trembles and then drops, or feels one side of the body numb, like ants crawling. Quick check. Ask the person to raise both arms to shoulder level and hold for 10 seconds. If one arm slowly drops while the other arm can still hold, this is a very clear sign of stroke. The particularly important thing to remember is that this weakness or numbness usually occurs only on one side. Not both arms weak together, but only one side. This is an important distinguishing feature from other causes. The third sign is difficulty speaking, slurred speech, or not understanding speech. The brain's language center is located in a fairly specific position, usually the left hemisphere. And when this area is damaged, the ability to speak and understand speech is affected immediately. The patient may suddenly speak with a lisp, speak slowly and with difficulty, as if the tongue is stiff, speak incomplete sentences, or say words unrelated to what they want to say. There are even cases where they hear others speak but do not understand, even though the ears are completely normal. Check. Ask the person to repeat a simple sentence like, "Today the weather is nice," or "I am at home." If they cannot speak clearly, speak incorrectly, or do not understand the question, this is a red alarm. The fourth sign is sudden severe headache, the kind of pain people often describe as like a hammer hitting the head. This is a characteristic sign of brain hemorrhage, that is, a blood vessel rupturing. The pain comes immediately, extremely severe, unlike any headache the person has ever experienced before. This is not ordinary headache due to stress or cold. It is like an explosion inside the head. If you or a loved one describes a headache this way, do not give painkillers and wait. This is an emergency situation. Brain hemorrhage can cause death within a few hours if not treated immediately. The fifth sign is sudden loss of balance and dizziness. I want to emphasize the two words, sudden, because chronic dizziness due to low blood pressure, inner ear, or many other causes is completely different from dizziness due to stroke. Stroke dizziness comes very quickly and very strongly. The patient feels everything spinning, cannot stand steadily, staggers like a drunk person, even though they have not drunk anything. It may be accompanied by nausea or vomiting. The problem is that in older people, dizziness is such a common symptom that many people, even caregivers, often consider it normal old age dizziness and let it pass. The important thing to remember, if dizziness comes suddenly, strongly, and is accompanied by any other sign in this list, consider it a stroke until proven otherwise. The sixth sign is sudden blurred vision or loss of vision. The brain controls vision, and when one part of the brain is damaged, the eyes will reflect that immediately. The patient may suddenly see blurred in one eye, completely lose part of the vision, or see double. That is, one object looks like two, especially. There are cases where the patient loses half the field of vision. They look straight, but see nothing on the left or right side. They are not aware of this, and may bump into objects on the blind side. If you see a loved one suddenly bumping into objects on one side, or turning their head unusually to look, or complaining of sudden blurred vision, pay attention and check for other accompanying signs. The seventh sign is less well known, but very dangerous. That is difficulty swallowing. When the nerves controlling the throat and esophagus area are affected by stroke, the patient suddenly cannot swallow normally, often chokes even when drinking water, feels food stuck in the throat. The danger of this symptom is that if the patient is given food or drink while choking, food or water can enter the lungs and cause aspiration pneumonia, a complication that can cause death. This is why one of the most important principles when suspecting stroke is not to give the patient anything to eat or drink, even plain water or medicine, until the doctor evaluates. The eighth sign is sudden confusion. The patient suddenly does not recognize familiar loved ones, does not know where they are, does not remember the date or time, does not understand simple questions. This is different from the gradual confusion of dementia. In stroke, this change occurs very quickly, within minutes. The person who was just talking normally suddenly looks at you with a strange gaze, asks, "Who are you?" This is an emergency situation. In older people who already have memory problems, this is even harder to detect, so caregivers need to pay attention to sudden changes in behavior or cognition, even if the person already has underlying brain disease. The ninth sign is numbness on one side of the body. Different from muscle weakness in the second sign, numbness is a crawling ant sensation, loss of sensation, or abnormal hot or cold feeling on one side, from the face, down the arm, down the leg. This is very often a sign of a transient ischemic attack, which the medical community calls TIA, a type of mini-stroke that lasts a few minutes to a few hours and then resolves on its own. Many people breathe a sigh of relief when the symptoms disappear on their own and think everything is fine. But this is a serious mistake. A transient ischemic attack is a warning that a real stroke may occur within the next 24 to 48 hours. The patient needs to be taken to the hospital immediately, even if the symptoms have resolved, to be investigated and prevented. And the 10th sign, which is also the easiest sign to overlook, is extreme fatigue and sudden unusual drowsiness. Not fatigue after doing a lot of work, not drowsiness after lunch, but a wave of exhaustion that suddenly hits, eyes closing. The patient almost cannot stay awake even while sitting and talking, even though they just finished sleeping. This may be a sign that the brain is damaged and no longer has enough oxygen to maintain normal wakefulness. In older people, this symptom is extremely easy to misinterpret. Old age, so sleepy, probably due to blood pressure medication. But if this drowsiness comes suddenly and strongly, accompanied by any other sign in the list, this is an emergency signal. Now I want to share with you some points that I find very important to understand these signs correctly. What makes stroke more dangerous than any other disease I have ever talked about is not only its severity, but its speed. Every minute that passes from the moment the stroke begins, about 2 million brain cells die. That is not a number made up to cause fear. That is biological reality. The brain does not regenerate nerve cells, like skin regenerates skin cells. The brain cells that die are dead forever. And each dead brain region corresponds to a lost function: the ability to speak, the ability to walk, the ability to see, the ability to remember. That is why people say, time is brain. Time is brain. It is not a slogan. It is not just a way of speaking. This is real science. Treating stroke within the first 3 to 4.5 hours can save millions of brain cells. It can be the boundary between life and death, between full recovery and lifelong disability. What is especially important for older people is that the signs can be very mild and transient. Symptoms appear and then disappear in 15-20 minutes. The patient feels fine again and does not want to bother anyone. But as I have said, this is the time of highest risk, because the real stroke can strike at any time after that. In medicine, we always emphasize, a transient ischemic attack is not good news. It is not lucky to have escaped. It is the final warning that the body sends to you before a real stroke occurs. So, when do you need to act immediately? The answer is very simple. As soon as you notice any 2 signs in the 10 signs I just mentioned, or even 1 sign, if it is clear enough and sudden. No need to wait longer. No need to ask for more opinions. No need to wait and see a little more. Call emergency immediately. I want to speak straight about the things to do and not to do when suspecting stroke, because this is the part that can make the difference between life and death. When suspecting stroke, the first and most important thing is to call emergency immediately. In Vietnam, it is number 115. Do not drive yourself to the hospital. Do not ask a relative to take you by motorbike. The ambulance can start treatment right on the way to the hospital. And more importantly, the emergency team will notify the hospital in advance, so everything is ready the moment the patient arrives. This can save dozens of precious minutes. While waiting for the ambulance, please record exactly the time the symptoms started. This is extremely important information for the doctor to decide on the treatment plan. If the patient is still conscious, keep them lying still. Do not let them stand up or try to walk. If they are unconscious or at risk of vomiting, place them lying on one side to avoid aspiration. Absolutely do not give them anything to eat or drink, even plain water, because the swallowing ability may have been affected. And the thing I want to emphasize once more, do not give medicine on your own, even aspirin, because you do not know if this is a stroke due to blockage or hemorrhage. The two types require completely different treatments, and the wrong medicine can cause a serious danger. The most common mistake I see in reality is that the family waits to see if the symptoms resolve on their own. Relatives see his face slightly drooping, but he can still talk, can still walk, so everyone hesitates to call emergency, hesitates to make a fuss, thinking probably nothing. Then, 1 hour later, 2 hours later, the patient faints, and by then, the treatment window has closed. Not because the family does not love, but because they did not know. Today, after listening to me, you already know. And I hope you will share this with those around you. Now I want to talk about something that, in my opinion, is even more important than recognizing the signs. That is prevention, because stroke, although frightening, is not impossible to prevent. In fact, experts estimate that about 80% of stroke cases can be prevented if risk factors are well controlled. The number one risk factor, and I do not hesitate to say it straight, is high blood pressure. Prolonged high blood pressure damages blood vessel walls day after day, month after month, silently and without causing any pain, until the blood vessels can no longer withstand it. If you have high blood pressure, controlling blood pressure to normal levels is the most effective stroke prevention action you can take. This means taking medication regularly, as prescribed. Do not stop the medication when you feel it's stable. And measuring blood pressure regularly at home. I advise older people to have a blood pressure monitor at home and measure at least 3 times a week in the morning before eating and taking medication. High blood sugar, diabetes, is also an important risk factor. High blood sugar damages blood vessels through a different mechanism, but the end result is that brain blood vessels are more easily blocked or ruptured. If you have diabetes, good blood sugar control not only protects the kidneys and eyes, but also protects the brain. High blood lipids, especially bad cholesterol LDL, thicken blood vessel walls, narrow the vessel lumen, and create plaques that easily break off and cause blockage. Periodic blood lipid checks and treatment when needed is an important step. About lifestyle, I know older people hear these advices so many times that sometimes they seem boring, but I want to say it again once more because they really work. Eat lightly. Reduce salt to less than 5 grams per day. Helps lower blood pressure naturally. Light exercise every day. Walking 30 minutes is enough. Helps blood circulate well, reduces blood lipids, and keeps blood vessels elastic. Sleep enough, from 7 to 8 hours, because while sleeping the body repairs and regenerates, and blood pressure naturally decreases, so the heart and blood vessels can rest. Smoking is one of the most dangerous enemies of brain blood vessels. It damages vessel walls, increases blood clotting, and raises blood pressure. If you are smoking, it is never too late to quit. Even at the age of 60, 70, quitting still significantly reduces the risk of stroke. Drinking a lot of alcohol also raises blood pressure and causes heart rhythm disorders. Both are risk factors for stroke. And prolonged stress, chronic stress, raises blood pressure in waves, causes inflammation in blood vessels, and keeps your body in a constant state of alert, without real rest. Regular health checkups, especially after age 60cc, is something I not only recommend but consider mandatory. Not because you are sick, but because you want to continue being healthy. In one regular checkup, the doctor can detect high blood pressure that you did not know about, increased blood lipids that you do not feel, transient heart rhythm disorders that you are not aware of. All of those things, if detected and treated early, can prevent a stroke in the future. Before ending, I want to say one thing that I think many people need to hear. There is a very common thought in older people, and also in their children, that when you are old, illness is normal, unavoidable. It is true that age brings unavoidable changes. But stroke is not normal for old age. Stroke is a serious medical event, largely preventable, and can be treated effectively if handled promptly. Your body is not silent. Before every major stroke, it has usually already sent signals, sometimes very small, sometimes just fleeting, to report that something is wrong. The problem is not that the body does not speak, but whether we listen, whether we recognize, and whether we act at the right time. Today, I have shared with you 10 signs. I do not expect you to remember all of them right away. But if you can remember only one thing, please remember this. When you see anything abnormal happening suddenly to the body, face, arm, speech, vision, balance, do not wait. Call emergency immediately. Because in stroke, 1 minute late can mean losing an entire lifetime. Your health is not something you should gamble with. And I, with all my sincerity, hope you will share these things with the people you love. Because who knows, this very information one day may save a person in your family.